today we are 1 month away from the beginning of the Children's Behavioral Health Initiative, and probably the biggest change in the system of mental health for children that's happened in this state. There will be, as people perhaps know, a community service agency for each area of the state. Wayside will be one of those community service agencies. We will be that in the Framingham area. There will be one for the Arlington area. There will be one for every area, and the areas are actually defined to coincide with the areas of the Department of Children and Families. So those will be the first 2 systems in the entire state of Massachusetts that actually match boundaries. Every other one has like different boundaries, but at least that's a start. That's a good thing. The community service agencies will provide a wraparound planning process, which really is the way of coordinating all of the many pieces of care. So making sure that the psychiatrist and the school and the relatives who help with taking care of a child and whatever state departments might be involved and so forth are all at the table together, talking about how to make a cohesive plan, how to make sure communication flows among all of the parties, how to make sure that needs and strengths are balanced so that we're not only looking at needs, but we're also really looking creatively at strengths, and how to make sure that when families or children and families do need services, those are adjusted based on things getting better or things getting worse, so that there's not this sort of crazy patchwork, but there's one seamless whole. So that will be starting July 1st. That will be coming. Wayside will be doing it, as I said, in Framingham. Riverside Community Services will be playing that function in this area. And then, as part of that planning process, people will be looking, identifying services that are needed. And again, Wayside and many other providers will be doing the in-home therapy services, the in-home behavior management, therapeutic mentoring, some of the things that people are probably familiar with in one way or another, or that sound like and are like things that currently exist. The exciting new things that don't currently exist will be, there are 2 in particular. One is particularly relevant to this group because so many of the people in this room have had experience with that, and that is the role of family partner, where there will be people who have parented children who are living with serious emotional disturbance, and those parents will be able to go be part of the team that goes to talk with families and help them figure out what they need. So there's a real peer-to-peer component to it. So it's not always the professional talking to the family, but there's a sense of we've lived this too, and that has been found to be extremely helpful often. So that will be actually newly expanded. I mean, there's little pockets of places that happens already, but that'll be expanded across the state. And again, Wayside will be doing that. The other thing, which is really exciting, and that Wayside will be doing in this area, and it's new. We'll be doing all the same stuff we always do, but the new thing is youth mobile crisis intervention. So how many people here have ever had the experience of calling the crisis team for a child? So a lot. Me too. Like lots of us. Okay. And how many of us, in the course of that call, have been told, take your child to the emergency room? How many have been told, bring your child to the crisis team, we'll do the evaluation there? How many of you have been told, call the police and have them take your child to the, okay. And how many of you have had a team come immediately to your house to address the issue there while your child is in crisis and to help you figure out what needs to be done without asking you to go somewhere? Good, a couple, good. Well, guess what? Starting July 1, everyone will be able to have that. That it's a really important thing. So starting July 1, when people call the crisis team, there'll be a conversation, obviously, to figure out, exactly what the needs are. But the crisis team will be able to dispatch a child-trained, family-centered, supportive team of clinician and support folks, and in some cases family partners as well, to go right directly to the home and help families figure out right there what level of care a child might need, how to resolve the crisis, take care of the immediate crisis needs, and then also stay stay involved up to 72 hours, so 3 days, to help make sure that whatever the initial idea was or the initial crisis isn't going to flare up again. There are ways to address it and so forth. So a really immediate and very thorough response to crisis. That's something that we haven't done in